2/3 of Americans are overweight or obese. Now, a new study suggests weight loss surgery may be the key to reversing the cardiovascular risks of obesity and potentially reducing deaths by up to 40%. A new study recently published in the Journal of the American Medical Association showed that people who undergo weight loss surgery may have the upper hand in warding off heart attacks, strokes, and even early death. The study looked at around 2,300 bariatric surgery patients with type 2 diabetes and compared them to a large group of similar patients who had not undergone surgery. Over an 8-year span, patients who had weight loss surgery had a 39% lower risk of heart-related disease, heart attacks, and stroke. Patients who opted for surgery also had a 41% decreased risk of early death, leaving some wondering if diet and exercise are enough to make a comparable impact. So, should more obese patients consider going under the knife? One of the authors of this study, Dr. Stephen Nissen, joins us now via Skype. Doc, thanks so much for being with us. Can you just tell us from your perspective what you find important from this study?
The results are really pretty astonishing. As you pointed out, about a 40% reduction in heart-related complications and about a 40% reduction in the risk of death over 8 years. Now, previously, the National Institute of Health had done a very large study of intensive lifestyle, diet, and exercise. And over a period of about 10 years, those people lost a little bit less than 10 pounds, and there was no reduction whatsoever in the risk of heart-related complications. I wish diet and exercise worked, but for the severely obese patients with diabetes, and all these patients had diabetes, there really aren't very good alternatives. And while surgery is a pretty major undertaking, the results suggest that it's a very large improvement in outcome, and that's what really counts for patients.
I want to bring into the conversation internist and nutrition specialist Dr. Melina Jampolis just to offer a different perspective. What do you take away from this?
The problem that I have with the study, first of all, the patients lost 3.5 times as much weight as the control group in this study. And we know that weight loss decreases blood pressure, decreases cholesterol, decreases your need for insulin, improves blood sugar control. So I think weight loss does work. And in the study that Dr. Nissen is discussing, the Look Ahead study, when you look at the group of patients that lost at least 10% of their body weight, so more than the average for this study, they actually did have a significant 20% reduction. So it does matter. Diet and lifestyle matters. This study is provocative, but the two groups are very different that they compared. So I don't think it's a correct control group. I think it's a little quick to jump to say, really, we should be doing surgery on all diabetics. I think lifestyle, aggressive diet and exercise does work. We have to do a better job as doctors of communicating that and helping our patients get those results, which lead to these really astounding changes.
Dr. Nissen, I want to ask you, do you think that there is something independent physiologically occurring after people have these surgeries that explains this beyond just the weight loss itself?
What happens is you reroute the gastrointestinal tract and you create enormous hormonal changes. And there's a lot of studies now suggesting that that change in the physiology and in the anatomy of the gastrointestinal tract is part of what is going on. Now, I have to quibble with your internist nutritionist here. These are people who have been trying for years, sometimes decades, to lose weight. These are people who are desperate. They've tried everything, and they were offered this alternative. The two groups here were very carefully matched up for characteristics. And while the study is not perfect, I do think the results are robust. They're published in obviously a very competitive journal. And I think until we can find a better way to get people to lose weight with dietary advice or medications, this provides an alternative for some of the sicker of these patients that can really reduce their risk of dying of their obesity.